Menstrual cramps. For so many of us, they're just a fact of life, right? A painful thing you have to deal with every single month. But what if they didn't have to be? In this explainer, we're not going to talk about just managing the pain. No, we're going to go deeper. We're going to investigate a potential root cause to see if we can stop these cramps before they even think about starting.
All right, so let's get right into it. If you go to the doctor, the most common type of cramp, well, it's officially labeled as having an unknown cause. An unknown cause. Doesn't that sound a little strange? What if that's just not the whole story? So that's what we're going to do today. We're going to treat this like a real investigation. We'll follow the clues the body leaves behind, clues that are often overlooked, and see if we can crack this case once and for all. So here's the deal. The typical approach, you know the one, it's all about masking the pain with things like NSAIDs or maybe altering your hormones with birth control. But think about it. Those are just treating the symptoms, right? They're not getting to the source of the problem. Our goal here is totally different. We're going to be detectives. We're going to follow the biological evidence, piece by piece, to uncover the actual root cause and find a real long-term solution. Okay, so that brings us to the first part of our investigation. We've got 6 key clues that our own bodies are giving us. Think of them like 6 pieces of a puzzle. And when we put them all together, you'll see they point to one single culprit. First up, clue number 1, prostaglandins. Now that's a big word, but the easiest way to think about them is as the body's pain chemicals. It's pretty simple, really. The source material is crystal clear on this. When you're experiencing those awful cramps, it means you have way too many of these prostaglandins floating around, just screaming pain at your brain. Okay, let's move on to our second clue and see how this story starts to build. It's a hormone called vasopressin. So what does it do? Well, its main job is to cause muscle contractions and squeeze down on blood flow. And guess what? During a painful period, vasopressin levels are way up, and that is what leads to that intense, squeezing, constricting feeling we know as a cramp. Now, this next one is really interesting. Clue number 3, high parathyroid hormone, or PTH for short. Get this, when your PTH levels are too high, your body literally starts pulling calcium out of your bones and dumping it into your bloodstream. And all that extra calcium makes your smooth muscles, like, the uterus, super sensitive. It puts them on high alert, making them way more likely to spasm and cramp up. All right, clue number 4 is a big one, inflammation. It's not just a vague idea. Studies show that when periods are painful, the uterus has way higher levels of inflammation. And this isn't random. It's being driven by a very specific troublemaker, an inflammatory pathway called NF-kappa B. Jot that one down, it's going to be important later. Okay, our 5th clue takes us into demographics, and this is a really important one. The source material points out that Black women are 33% more likely to have severe cramps. Now, that is not a coincidence. It's a huge piece of the puzzle. And whatever our final theory is, it absolutely has to explain this. And that brings us to our final clue, clue number 6. And for this one, we're going to look at a medical treatment that sometimes works, calcium channel blockers. So these drugs do exactly what their name says. They block calcium from getting into muscle cells to stop them from contracting. The fact that this works is a massive clue. It tells us that a big part of the problem is too much calcium flooding into the uterine muscle, causing it to go haywire. So let's recap. We've got our 6 clues. 1, way too many pain chemicals. 2, intense contractions. 3, a hormone imbalance that makes muscles twitchy. 4, sky-high inflammation. 5, a clear demographic link related to skin color. And 6, a treatment that works by blocking calcium. I mean, what on earth could possibly connect all of those dots? Well, it's time to unmask the culprit. After looking at all this evidence, the source material points to one fundamental issue right at the heart of all this. The root cause is a severe vitamin D3 deficiency. That's it. I know it might sound almost too simple, but stick with me. Let's connect the dots and I'll show you how this one single deficiency perfectly solves every single clue in our investigation. Okay, get ready because this is the big aha moment. We're about to see how vitamin D isn't just a band-aid for 1 or 2 symptoms. No, it addresses the entire biological chain reaction that leads to cramps in the first place. And here it is. This is how the case is solved. Remember those high prostaglandins, the pain chemicals? Well, vitamin D literally downgrades them. What about the high vasopressin causing contractions? Vitamin D suppresses that hormone. That high parathyroid hormone leaching calcium from your bones? When you have enough vitamin D, you can absorb calcium from your food, so PTH doesn't need to spike. and that inflammation driven by NF-kappa B, vitamin D is an incredibly potent anti-inflammatory that just turns that whole pathway off. Now, the demographic link? This is fascinating. Melanin, which gives darker skin its color, is amazing at blocking UV rays, which also means it blocks the production of vitamin D from the sun. And finally, why do those calcium blockers work? Because a vitamin D deficiency almost always goes hand in hand with a magnesium deficiency. And magnesium is the body's natural calcium channel blocker. It's what keeps your muscles relaxed. Without it, you've lost your natural protection. See? It all fits perfectly. Okay, so we've identified the culprit. The big question now is, what do we do about it? What's the plan? Now, a really quick but important note here, everything we're talking about is based on the source material. Before you start any new supplement routine, especially with the kind of doses we're going to mention, it's always a good idea to talk with your own doctor or healthcare professional. Okay? Great. With that said, let's get into the action plan. So the source lays out a core 3-step strategy. Step 1, supplement smartly. This means taking vitamin D3 and magnesium glycinate every single day. They're a team. They have to be taken together. Step 2, you gotta improve absorption. You can do this with a low-carb diet and even intermittent fasting because that helps improve your insulin sensitivity, which is crucial for your body to actually use the vitamin D. And step 3, add in some high-quality omega-3s, like from cod liver oil. Studies have actually shown it can be just as effective as ibuprofen for pain, but without all the nasty side effects. All right, so let's talk numbers. The source recommends a daily dose of 20,000 IUs of vitamin D3. And listen, this isn't just something you take when you feel pain coming on. The idea is to take it every single day to build up your body's levels, to build up a reserve. That way, when your cycle starts, you're already protected. You're stopping the problem before it even begins.
Now that vitamin D and magnesium combo is the absolute core of the strategy, but there are other scientifically proven things that can give you some extra support. We're talking about vitamin E, vitamin B1 from nutritional yeast, and zinc. Regular exercise is huge too. And for that immediate relief when you need it, things like fenugreek, a good old heating pad, and ginger have all been shown to be just as effective as NSAIDs, which is pretty amazing when you think about it. I really want to land on this quote from the source because it drives home the most critical point of this whole plan. It says, without vitamin D, magnesium won't work. And without magnesium, vitamin D won't work. You need both. It's not one or the other. They are an absolutely essential team if you want to solve this problem. So that leaves us with one final, pretty powerful thought to chew on. Could it really be that one of the most common, painful, and disruptive health issues that women have faced for centuries isn't some unsolvable medical mystery after all? But instead, it's a problem that can be solved by something as simple and fundamental as the sun and the key nutrients that work with it? When you look at all the clues, the evidence is pretty darn compelling.